still some weakness on the local unit there. But let's focus on this now. After years of discussions between government and the private healthcare sector, it looks like the National Health Insurance will finally be officially rolled out. Government has indicated over the next 3 years, 8.8 billion rand will be budgeted to implement the NHI. But there have been a number of concerns about how the system will work alongside the private sector. Let's find out from Dr Katlego Mothudi, who is the Managing Director at the Board of Healthcare Funders. A very good afternoon to you, Doc, and thank you for talking to us this afternoon. Let's start with the adoption of universal healthcare coverage in South Africa and some of the principles in a medical scheme environment that put the interests of the citizens first to achieve greater access to healthcare. How exactly will that look like?
When you consider what the principles are, you have to look at what sort of access the health citizen is actually getting. Secondly, the standard or quality of services that are rendered or the outcomes thereof. And thirdly, there should not be any additional financial outlay at the point of care. Now, in terms of how the private sector, largely the medical schemes environment, has been functioning, largely due to guidance by the legislative and regulatory framework, we have a very curative or hospice-centric system, which means that there's very little money that is spent on prevention and promotion of healthcare services. And we believe that schemes can start, or medical aid schemes can start by aligning themselves with the principles of healthcare and adopt a more preventative or primary care focused attitude towards healthcare provision.
Yes, and that's going to be important as we focus on a person-centric health ecosystem. How does that play into that component of the National Health Insurance as it's rolled out over the next 3 years or so?
I think the thing to remember when we talk about healthcare, the focus should really be on the user. And what we've been saying now recently is that before a person becomes a patient, there should still be a focus on that. It means that you focus on those elements of healthcare service delivery that makes them a priority even before they become a patient. The second element is that of empowerment of the person or the patient to make sure that if I'm diagnosed with an ailment, I am empowered to take full responsibility. It's not the practitioner who is treating me, whose challenge it is. It's actually a partnership, but with more weight on the patient, so that we are able to follow whatever guidance we get from the practitioners of the system, in the system.
Yeah, we've had different stakeholders weigh in on this NHI discussion over the last few days. Business Unity South Africa, as an example, raising some concerns about how the private healthcare sector will be incorporated into national healthcare, asking for government to allow it and medical aids to continue as they have been. In your thoughts and in your engagements, Doc, how is the private healthcare sector going to be incorporated into the system, if at all?
There are two parts to look at. The healthcare service provision component is outlined, I think, almost clearly, in that there would be contracting of healthcare practitioners as well as facilities to provide these services. Where there's often disagreement and to boost us even input, is the issue of the healthcare funding and the role of medical schemes. There is a clause 33 which dictates that once the NHI is fully implemented, medical schemes will only be allowed to provide what is called a complementary service. What that means is that any service that is deemed to be provided by the NHI fund, the schemes will not be allowed to provide that service. We believe that that should not be the case, in that there should be a partnership that would eventually find natural attrition as the NHI fund matures. We are acutely aware of the challenges that the healthcare system currently faces. And I think the focus maybe has been a bit narrow because we're looking at NHI fund, and the NHI fund fulfills only a component of what universal health coverage is supposed to be. That is the funding element. There are many other things that should be looked at in tandem. The human resources element, leadership and governance, service provision, we've got issues around infrastructure, etc. So we believe that medical schemes could be used as an asset to support NHI to actually operate alongside the fund up until a stage where there is maturity and vast improvement in the service, and there would be natural attrition. But we've seen elsewhere that there will always almost be the need for the private sector to participate. Recent reports from one of the older systems in the UK, the NHS, actually indicates that right now they need the private sector even more to support the system.
Yeah, and I wonder, as we work towards creating a mature system that works seamlessly and efficiently, Doc, how will the electricity crisis impact that? Because we are seeing already the healthcare space is up in arms about the instability of the grid and the impact it's having on health practitioners to do their jobs at these major hospitals and clinics.
I think what that emphasizes is that we should never have a narrow focus when we look at any challenge, whether you're trying to sort out healthcare issues, etc. And the guidance is there. If you look at what the Sustainable Development Goals prescribe, they look at tackling all the other issues, whether you're looking at gender parity issues, empowerment of women, poverty alleviation, sanitation, etc., because each and every one of those does have an impact on the healthcare outcome. And electricity supply is actually also an important cog as part of the continuum of healthcare service provision. It means that we need to be cognizant of a continuous supply of services and make sure that facilities are looked at. I mean, the recent court ruling gives credence to that. And also maybe in terms of future planning, we should make sure that we should never find ourselves in an embarrassing situation where we find it difficult to still attend to medical services. The second area is that healthcare service provision is not only provided in facilities. A lot of it actually happens in the home. If it happens that you've got a lung disease that requires that you use oxygen, these concentrators require that you must have a continuous supply of oxygen. So if you just focus on one particular element when you solve a crisis and not looking at the entire environment, you might actually miss out on some of the elements that are here.
Thank you very much for those insights, Dr. Katlego Mothudi, who's the MD for the Board of Healthcare Funders, breaking down the recent developments around NHI, the concerns, and really what should be focused on as we look to create a mature system, healthcare system in the country.